Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we talk quality of healthcare and explore what that actually means. Let's dig into performance measurements, the equipped platform, pharmacy goals, and personal goals. We will also occasionally cover topical healthcare news and maybe throw into the conversation a few of our own nerdy passions and hobbies. So turn us up. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. This is your host, Nick Dorich, and we welcome you to episode 35 of the Quality Corner Show. Our tone for recent episodes have focused on quality measures, quality improvement, and education. None of these items are managed or developed in a silo, and there are often many steps and pieces that lead to a final product. Back in episode 1 of the Quality Corner Show, we spoke about PQS and our aim for the series. This included reference to the Pharmacy Quality Alliance, or PQA. For those who know about PQA, they launched in 2006 as a new private-public organization to develop, endorse, and support the use of medication-related quality measures. Our team at PQS is intrinsically tied to PQA, as there is sort of a parent-child relationship that exists between the organizations. In fact, the Equipped Dashboard started as a funded project that PQA managed way back in 2008. This eventually led to the launch of our company in 2013. So if you're using Equip, you may recognize that many of the measures in our Equip dashboard are actually PQA measures. Given our communication path with the recent episodes, it seemed like we were long overdue to have the PQA team on our show. Therefore, it is exciting today because we get to talk to PQA team member Jake Galdo, and he's here to talk about a great continuing education opportunity for pharmacists to continue their quality efforts. It's always best to begin at the beginning, so before he starts to share about education and quality improvement, let's learn more about Jake and his role at PQA. Jake, without further ado, welcome to the show.
Nick, thank you so much for having me. It's a real pleasure to be on this presentation and this podcast and talk with you and the listeners about healthcare quality and medication use quality. So as Nick mentioned, my name is Jake Galdo. I'm PQA's Director of Education and Program Development. And in this role, I help to design the strategy and programmatic content for a lot of our educational programs. We like to think at PQA that we offer 4 unique opportunities for organizations and individuals to engage with quality improvement and medication use quality. In those 4 areas, we talk about education, research, measure development, and convening. And so it's really exciting to be part of those pillars and to be the one that helps drive those educational opportunities for PQA. Prior to joining the team, I was actually in academia as a community pharmacy residency director, and prior to that, I worked in independent community pharmacy practice. So if anything, I always like to say that I am a community pharmacist at heart, and I'm excited to share those experiences with the greater communities on medication use quality.
We're glad to have you here today, Jake, and thank you for being a part of the Quality Corner Show. I know you are here to tell us about a wonderful opportunity for pharmacists and other healthcare providers that's all about quality, specifically quality in medication use. So first things first, what is this education program that we're talking about? Where can pharmacists and other healthcare providers find it? And why is it important for PQA to release this course? PQA's focus is on developing quality measures, but this course is really designed to help people understand the measures. I'm starting off this podcast and this questionnaire with a bang by throwing 3 questions at you all at once as part of one topic, but to me, it really is all interconnected, much like quality and quality measures and how that improves patient outcomes. So can you give us a run through of this program and provide us an introduction about the course that PQA is offering?
Yeah, of course, Nick, I'd love to. And I love that we're starting out with a bang. This is almost like a fully loaded question. So please forgive me if I talk for a very long time, but I'm excited to share this story. And to really start out with, I'd like to begin by discussing the importance of the program and how we see it. It's the first continuing education certificate program focused on medication use quality. We created it in response to our members' calls for more education in this space, and it fills a major gap in continuing and interprofessional education. And I highlight the fact that I say interprofessional education because this continuing education program is certified for CE credits for pharmacists, pharmacy technicians, nurses, and physicians. And we're really excited to be able to share this with the larger healthcare community. The knowledge and experience that's shared by our faculty through this program will help support more consistent and higher quality medication use in our diverse care settings across America. So I think that kind of gives you the why. And it really is this area of why we're so excited about it, because we notice this need within our members, and we notice them constantly coming to us saying, help us understand medication use quality. And we're excited to be able to share this with our membership. And those not part of our membership, so they can better know medication use quality and PQA and even PQS. This program is a 15-hour continuing education certificate course. Now, 15 hours sounds like a lot, but we feel like we've covered a lot of information, and I think it's really concise in how we do it. We did land on those 15 hours because that's a definition, according to Pharm.D accreditation, to be considered a certificate. So we meet that designation. This truly is a certificate course. And in that course, there's core curriculum and then various elective tracks for the learner to gain insights on different areas within healthcare quality and medication use quality. And so if you don't mind, I'm going to just kind of keep on going into it because it's so exciting to me, and really talk about the different aspects of this program. First, we start with a deep dive into the quality landscape. We let people know what is going on and why do we even talk about quality. And it's funny, in initial drafts of kind of the content, we started out with, the 1800s and talking about how Navy sailors had to have health insurance. We decided we didn't have to go that far back in history, right? So we really focus on what's going on now with the Affordable Care Act and other legislative changes that says that we need to put quality at the forefront of what we do. And after we establish that kind of kindling for this change in our healthcare system, we then jump into measurement science, or the science of measurement. And it's kind of interesting because this is the basis of healthcare quality, but it's actually a newer science, and it's kind of vague and gray. And so we actually spend a really deep amount of time talking about, like, what is this science and why it's important? How do you make a really good quality measure? Where does that quality measure go once it's developed? And then what does an effective system look like? And of course, I have to give a giant shout out to Todd over at PQS, because in that section, where we're talking about measurement science and measurement systems, he actually gives an amazing review of the Medicare Part D star rating system. And it's a really engaging, in-depth look at what happens in our environment when we have really good measures that meet rigorous measurement science that are implemented in a measurement system that can transform and impact lives. And then we start talking about the influences on quality. And so when we think about influences on quality, we think about the social determinants of health. We think about health information technology like interoperability, and we think about the regulatory landscape. And we would be remiss not to educate our learners about these influencers on quality and healthcare, because they are driving how we look at why we implement different measures or the challenges we have to measure implementation. And then to round out our core content, which is about 10 hours of material, we actually get into practice. And we start driving into quality improvement initiatives. How do you find areas? And we kind of create this framework for quality improvement. And we teach it to the learner, and we challenge them to start to look at their practice and start to identify measures that are being applied to them to create innovative services. And we give best practice examples from our colleagues in community pharmacy, from those that work within health plans, but also in health systems. So we talk about how you can start to really change practice and make this what you do day to day, and not just something that we have to do because we have a report due every 3 years. And then we have an elective section. And that elective section is up to the learner to pick about what they want to do. So they can pick to learn more about measure specifications, or they can pick about learning about measurement systems outside of just Part D. So talk about MIPS, Medicaid, commercial insurance, and really understand that entire arena. And then we bring it all together. As you can tell, we can definitely hit 15 hours of content because I keep talking about our content. And so at the very end, we make it very tangible and very practical. And we start to have the learner go to different measurement systems, pull up quality measures from their neighborhood by typing in their zip code. And then they are challenged to create new initiatives of what they would do if that's where they were practicing, as a way to show that this isn't just something that we talk about at the DC federal level, but this is in our backyard. And how do we start to change it? And so I know that I just spent a lot of time talking about the program itself and why we're so excited about it. And I'm pretty sure I'm missing one of your questions, like where is this located? And it is located at the new PQA Education Center and you can access it at pqa.ceimpact, that's one word, .com. And we can also provide that information on PQA's website, which is pqaalliance.org. Now, again, you wanted to start out with a bang, Nick. You asked me 3 fully loaded questions, so I just talked for a very long time. I think I've covered everything, but what else can I help address about our program?
Jake, I'd like to say that we addressed all the questions we're ever going to have, but this is such a big topic that we'll have a lot more to get into. A couple things I want to look at, or just an immediate response. It's absolutely necessary, and I love the interprofessional approach. I was on a social media platform last night. I won't say which particular one or where it was, but I did see a post from a pharmacist referring to how shocking it will be when physicians and other providers have to start looking at quality measures. And to me, that was just very funny because that's been around for other providers for a very, very long time. So we've got a lot of education that has to happen, not just for providers on measures that they're looking at, but between providers. When it does come to this information, and this might get into our next question, but why is this a good background? Why right now? Why right here to provide this content?
I love that question, Nick, and I love the idea of why, because that's really the basis of this. It's the context for why we initiated this. And there are a couple things that really kind of galvanized us at PQA to drive in this direction. First and foremost is that we're an association. We listen to our members. We listen to their requests, their concerns, and what they want to know. And we had so many members and their member organizations coming to us saying, help us understand quality. Like, you talk about measurement science, but what does that even mean? Like, what are we talking about in quality? So we had our members asking for education. And then when we think about one of the core pillars at PQA, we're developing quality measures. And we do that in a very transparent, consensus-based process where we're getting our members to sit at the table with us and create those measures. And I always like to think that if we're going to have effective measures being developed, everyone needs to understand the conversation that's happening. We have to all speak the same vernacular. And so education can get us all at that same level playing field. So we're talking about the same thing. So when we get to those key critical decisions within a quality measure and that decision of how you make that measure, everybody understands the full context of why. So we're addressing a member need. We're then helping PQA and our members create better, more impactful quality measures because we're more informed going into that measure development. And then finally, maybe this is because I'm a recovering academician, we did a needs assessment. We did a survey and sent it out to our members and said, if we did this, do you want it? And everyone said in a very resounding way, yes. And so that really created the why, is it really helped establish that there was a need in the marketplace, there wasn't anything else going on, and we wanted to support our members to better understand healthcare quality. And if I am very selfish, I'll say that from an undercurrent of all of that, it's for the patient. We're really doing this to improve the care for the patient. And so if we want to talk about why quality measures are important, it's because they're tracking and evaluating how we care for our patients. And then if we're going to say, how do we get better at it, then we have to understand this landscape so that way we can understand what that score means so we can make impactful change.
Jake, that's great. And I especially appreciate the point at the end. Again, we've gone through a lot of information here, but it does come back to how do we help practitioners provide the best care they can to improve patient care. Next, we're going to get into our next question and the next steps. And that's been very good already as far as our initial background for the program. But we do know that PQA developed this course like everything it does. It's a very collaborative process with stakeholders, with members. And I want to dig into that part a little bit because it's kind of like the seeing behind the curtain with the Wizard of Oz. I don't think there's a lot of pharmacists or other providers that are familiar with measure development or these kind of education courses as to understanding how they get created, who's involved with it. It's not simply just a directive, and you already spoke to the needs assessment and other parts of it, but can you share who was involved with this project? And ultimately, I'm interested in hearing why these groups had such a strong commitment to developing a new quality improvement, quality measure education resource.
Of course, and we're very lucky at PQA to be a member organization to have over 250 very unique and diverse members helping us understand this landscape. So we brought together the nation's leaders in medication use quality to help us create this program. They provided counsel on the top issues that shape quality for years to come, and they needed to be included in the program. So some of the organizations, and again, for any of those content developers or folks that helped us, if I miss you, I apologize, but just kind of off the top of my head, I can think about organizations like PQS, again, mentioning Todd Sega and his support of the program, the payer UPMC, we had Walgreens, we had Gateway Health Plan, we had point of care testing, the National Quality Forum, we had a variety of life science organizations, we had our academic members, we had independent community pharmacies, and so many more that really came together in a variety of capacities. We had individuals help us drive the content, so we had a content advisory committee. We had individuals help us understand how to market this and get it to the people that need it. And so we had a business advisory committee. And then we also had just a variety of individuals help us develop content. And so we are really lucky to have been able to lean on our members to understand and leverage their expertise in this area. And then when you kind of ask that question, like, why were they excited? It's because this is what they do in their day-to-day lives and they want to help others. When I think about our colleagues at Walgreens, we were working with some of the regional directors, the quality directors of that organization, and their day-to-day lives focus on how do they get information down to that frontline community pharmacist, so that pharmacist has the context on why they're calling a patient about not being on a statin medication, or why they're trying to help complete some comprehensive medication reviews at the store. And so they knew that there's a resource that's needed to get to that front line, and they wanted to help us build it so that their organization can implement it and move it forward. We think about our payer partners and the fact that this is the life that they live in. This is the work that they're doing, and they have new team members that come on at a regular cadence, and this is a new tool that they can incorporate as part of their training to help them understand healthcare quality. When we talk to some of our life science members, some major life science organizations have huge quality strategies where they have team members to get dedicated towards the quality of not just the organization, but how the quality of healthcare impacts and their medications impact the quality of care for patients at a population health level. Whereas we have other organizations that are just now trying to create quality strategies. So we brought them in to say, what do we need to do to help you and help your team members affect change for be it either your clients or internally to be a better quality organization and really keep that patient at the forefront of what we do.
Jake, related to this, I think you hit on just about every sector that may be involved with touching the patient. And that's why it's important that so many different stakeholders are involved. Not any one of us or any one sector has all the answers. So it's important we come together and learn some lessons together, that we were able to grow and expand our capabilities. And as we're talking about improving the patient, this may or may not be related to specifically the course, but PQA does have engagement with patient advocacy groups and those that are representing patients, right, when it comes to the measures. And again, they may not be related to the course here, so it may be a bit of a tangent, but do you mind shedding some light on that or kind of how that becomes involved with PQA for the audience?
Yeah, so when we think about measure development, we want to make sure that we have a diverse set of viewpoints and stakeholders engaged in creating measures so that we make measures that are meaningful and can be implemented. And so in that capacity, when we convene a group and we say, let's get 20 individuals together to create this measure, they might be pharmacists, physicians, nurses, and then we always reserve a couple seats for patients and patient advocates and caregivers so that we make sure that that view is part of this entire journey. Now, we don't necessarily have a patient-centered module as part of the curriculum for the certificate, but I will say as a spoiler, so don't tell anybody, right, as we're telling everybody, that at the very end, that practice-based component where you're actually like looking at the quality in your neighborhood, we designed it so you kind of approach it with the lens of your professional capabilities. You're approaching it saying like, I'm a pharmacist, I'm a community pharmacist, let me type in my zip code, let's see what the health systems look like in my area. And then we pivot halfway and we say, okay, go back to those 3 health systems, and now all of a sudden you're a patient. You're 57 years old, you have diabetes, and you've had a heart attack, and you're worried about that second heart attack. Now look at those health systems. Which one do you want to go to? Not just which one from a professional standpoint is the best quality, but which one do you, the patient, want to go to? Because for me, when I look at those quality measures within CMS's Hospital Compare, the quality measure that I always just go to, the one that I focus on personally, is cleanliness of bathrooms. I don't know about you, Nick, but if I go to the hospital, I want a clean bathroom. Like, I can be okay if they don't educate me on medications. I'll fill in the gaps myself, right? But I want a clean bathroom. And so that's the quality measure that I always look to from that patient and caregiver perspective. And so when we designed the content, especially that practical part, we wanted to make sure that the learners kind of shift their view, shift their perspective, and start to say, what happens when I look at this as a patient and not as a healthcare professional?
Yeah, Jake, I think a patient or patient caregivers that feel more comfortable, whether it be at the hospital, at another care setting, at a pharmacy, the more comfortable they're being there, including maybe how that cleanliness of the bathroom is going to lend them to being more trusting and working with those healthcare providers. So I always talk to pharmacists about, it's not just that we have the knowledge, it's that we have a lot of the soft skills that go into it, and that we're always providing a good patient experience. And that comes through in a lot of different ways with quality measures and education. And it's why we need to keep learning, and why a course like this is particularly important. So I really appreciate, I did not think or did not expect that was where the conversation was going to head in that direction today, but that's a perfect example of why it's important for us to keep learning. Jake, we're going to move to our third question here, and this is a 15-hour course, as you explained, and it's accredited for continuing education, which is very convenient for those like myself that need to complete 15 hours of CPE in a year. So my question for you, is this a good course is it a good starting place for those that want to learn about quality improvement or process? If I'm thinking back to college, is this like a quality improvement 101 course, or is this more of a 200 or 300 level course? And then after they complete the course, what can the learner, what can the practitioner, are there places that they can go next if they want to go even further? What should be a good goal for when a pharmacist or other healthcare providers complete this course?
Awesome. Thanks, Nick, for that question. And of course, we're so excited for this. And it is a real struggle when you think about launching a 15-hour certificate program. Do you make it the 100 level, 200 level, or 300 level? And as I kind of explained, we have a very diverse set of members that engage with us. And then this isn't just designed for our members, but it's for those that are outside of PQA's membership, those that might be interested and want to start to learn more about this arena. And so I'd like to think that we covered at least the 100 level, and we start to even get into that 300 level. It's interesting because we had some of our new fellows and students that we have on rotation with us kind of beta test the program right before we went live to give us some critical feedback for any changes that we need to have. And I got to call out our fellow Chris. He looked at the first two lectures, and he texted me and said, I really hope we're doing more than just that. I kind of knew this material. That's the history part. And I'm glad he knew the history. And then after that, he's like, all of this was brand new. I've never heard of this. He's a newly graduated pharmacist, and it was all brand new information to him. And so to your point, I think that we do cover that 100 level, but we go so much deeper because, again, 15 hours is such a long time. But we recognize that that's a long time. And so we actually designed the program to be super engaging. We started to leverage new pedagogic methods, thinking about worksheets, deep dives into content, making it practical, like I've mentioned about typing in your zip code in various areas. So we made it where the learning wasn't just, here's an article to read, or here's a lecture that somebody did a voiceover on. Now those are there, right? But we made it a little bit different. We added all these other things in there. We actually went to PQS and we leveraged some of your educational videos that talk about healthcare quality in a minute or two as a way to complement what is already happening within the program. So we're kind of layering all of this content on top of itself. Because again, it's all about thinking about the needs for our members. There's just such a spread of diversity on that knowledge. We wanted to fill in that foundation. And so this builds the foundation, and then we start to put materials on top of it. So we start to take a deeper dive. To be very candid, there is a larger emphasis on medication use quality because that's who we are at PQA, than healthcare quality as a whole. We cover healthcare quality as a whole from a public health perspective and pop health perspective, but then we go really in depth within medication use quality and what does that look like in the healthcare arena. To your question about like what's next, it's more elective tracks. We have more and more coming and planned for the future. And so as people take this program, they're able to do the 10 hours of core, 3 hours elective, 2 hours practice-based. They have the certificate. But then to be lifelong learners, we want new content constantly coming out with newer and fresher perspectives within healthcare quality so that people can kind of take deep dives. We're even talking about building some that are disease state focused. So a deep dive in opioids, a deep dive in diabetes, some of these therapeutic areas that transcend practice settings and really talk about like the vertical integration of quality and what does diabetes quality look like from a health plan to a pharmacy to a PBM? Like, how do we start to talk about it from the big picture and get everybody working in the same direction? And ultimately, the whole true goal of this program is to equip the learner to be a quality change agent. We need them to understand what healthcare quality is, why it's important, and then to be the person that's impacting change at their practice setting, either because they're able to tell everybody what that quality measure means, or because they've designed a new innovative service that improves the care being delivered.
In what's going to be a somewhat shocking development, Jake, I actually have very little to add or to summarize after your response. This to me is really exciting because it is setting the groundwork. It's providing some of the advanced levels. And then as you referenced, more elective tracks, more information. Quality is an important aspect, and it's always going to be an important aspect of healthcare. And it's going to grow and expand more and more. I would add for our listeners a reminder that, quality measures, those are continuously looked at, reviewed for their application, appropriate data sets. Are there new guidelines that change? So measures always get updated and evaluated. So does our education. So we always really have to take it and run with it. It's part of the oath of the pharmacist that you're committing to a lifelong of learning as well. So I really applaud Jake, you and the PQA team with taking this initiative and effort. For me, I can say that I've got the email about this course that's been in my inbox. I haven't accessed it yet, but this has definitely given me a reason to go back and check into it. So if I'm being honest, I may want to start working on that. So let's go ahead and start getting around to closing out our podcast here for today. Jake, I appreciate your participation in today's show, and I really think this is a well-developed resource for practitioners, not just the pharmacist practitioners, but all practitioners. And it's got some good application for really everyone that's involved with the healthcare system. This is just one of many great ways that practitioners, including pharmacists, can engage in some way with the Pharmacy Quality Alliance. Before we close, I think we would be missing a tremendous opportunity if we didn't include your notes on how and or why folks should be involved with PQA starting today. So do you mind getting into how people can get involved and what's the benefit of working with PQA?
Of course, and thank you for giving us this opportunity to talk about ourselves, because it's exciting. We are really involved within healthcare quality and what's going on at a national level, and we love partnering with our member organizations and others to impact change in a very positive direction. So just kind of at that top level, again, PQA is a national quality organization dedicated to improving medication safety and appropriate use. As a measure developer, researcher, educator, and convener, our quality initiatives support better medication use and high quality care. There are opportunities in all four of these areas for pharmacists and other healthcare professionals to shape the future of medication use quality. I'd encourage you to go to our website, which is pqaalliance.org, and see if your member organization is there. If your employer is a member of PQA, then we want you to get in touch with us, let us know, and we'll get you connected to your PQA key contact and find ways for you to get engaged. But at any time, you can always go to our education center and start taking education offerings that we have. Many of them are for free. The certificate is not, unfortunately, but everything else is free there. So just get engaged with the learnings that we have and start to really better understand healthcare quality.
Jake, thanks for that. For myself, speaking personally, I've been involved with PQA items for about a decade now. Makes me feel old saying that. And it's very interesting because I know there's topics that I think are really important, and I've been able to contribute in some ways with PQA for those. But I've also seen items where to me, it's not necessarily what I think about as important for healthcare, but as you get involved with more stakeholders, other members that are there, you see how this is all really beneficial to patient care. So it's a great opportunity. Just like anything in life or anything in pharmacy, it takes all of us to share, provide our voice and our experience to cause and create change and to help create a better patient experience. So I would encourage everybody to follow up with PQA as Jake had suggested there. Jake, final item for you today. I appreciated the time again. Can you remind us where everybody can locate this course and where they can hopefully get some of that continuing education credit, complete some elective courses, and learn more about the quality process.
Of course, and thanks for giving us this one last opportunity to plug the website. I think the easiest place to go to is the main PQA website, which is pqaalliance.org. And from there, it can redirect you to frequently asked questions and other information about our medication use quality and other things, and all things PQA related.
Thank you, Jake. We appreciate you coming on the show today and representing PQA and discussing this medication use quality program. Very excited. I hope that a lot of folks are going to check it out once they hear this podcast. Quality in the healthcare sector and for pharmacy professionals involves a continuous learning process, and having resources such as these now available, it just benefits everyone, from the provider to the system, and ultimately, and most importantly, as you referenced, to the patients. So for everyone, please check out the certificate program. Again, you can see that at pqaalliance.org. So be sure to check that out. With that, we're going to go ahead and close our podcast for today. And we appreciate everybody listening into this episode of the Quality Corner Show. And as always, our team here at PQS has a couple of favors to ask of you, our podcast listener. First, we encourage you to share this podcast with 2 friends, because if you share this with 2 friends and each of them shares it with 2 friends, it really helps us hit a larger listening audience. Second, we also want to take a moment to remind you to subscribe to the podcast wherever you may find it. And then, if you have any questions or topics you would like us to address, please contact us. The best way to do so is to email info@pharmacyquality.com. Let us know what is on your mind and what we can address so that you are fully informed. Our goal is to continuously improve our podcast content and to provide meaningful information to our listeners based on current topics in healthcare, technology, and quality measurement. We want to help you become as effective as possible in how you care for patients and improve public health outcomes. So until next time, we wish you well.